The December meeting of the Louisville Metro Board of Health is called to order. As always, this meeting is being streamed live on Facebook. Given the holiday season and commitments that we've all made, this meeting will be short and solely focus on issues needing action and announcements. There will be no updates unless we need to vote on an action. We will return to our regular format January the 4th, it's hard to believe, 2023, for our first meeting under the Greenberg administration. Our meeting will be virtual only and will feature Dr. Kelly McCant, Executive Director of Norton's Institute for Health Equity, as well as Norton's Heart and Vascular Institute. In concert with our focus on housing inequities, Dr. McCant will present for discussion his perspectives on the impact of redlining on public health. Before I begin the actions, I wanted to issue a huge shout out and a holiday hug that comes with deepest appreciation on behalf of all of you and myself to the health department's team for their incredible service this past year to this team and to the community, and hope you enjoy just joyous holidays, and for the new year may it bring only the very best it has to offer. And now on to business items. The first item is approval of the November meeting minutes, which were distributed. The chair will entertain a motion to approve the November meeting minutes with any corrections or edits or anything you may have. Is there such a motion?
Moved.
Second?
Second.
Any opposition? The meeting stand approved as distributed. Second, at the November meeting, the board approved support for ensuring a program or an initiative called Parks for All, which removes any barriers to equitable access to our public parks. Recall that this was one of the strategic objectives within the department's Healthy Louisville 2025 strategic plan for improving community health that was based on a community needs assessment. Parks for All, bipartisanly co-sponsored by Democrats council members James Arthur Fowler and Republican council member Pia Gentini, is now before Metro Council and will likely be voted on later today in committee in preparation for tomorrow's council meeting. Staff has worked with the relevant council members on its content and approves the work. A copy of Parks for All was included in your materials. The chair is now seeking a motion to approve the Parks for All policy, allowing us to issue a statement of support for it. Do I hear such a motion?
So move.
Second?
I second.
Discussion? All those in favor, aye.
Aye.
Opposed? Motion carries unanimously, and the wonderful Arlena will distribute it to council members. I thank you, and I thank the team at the department, because as we look back on this year, we have issued a number of very executable policy statements that have the potential for planting seeds that will definitely positively disrupt the system. And so thanks to you for that support. As we approach the commencement of a new mayoral administration, the department is working with the Fisher-Greenberg teams on transition. There'll be some of the leaders will be meeting with them Thursday afternoon, and I will be meeting with the team this afternoon. Recall that we hosted both mayoral candidates for separate meetings as our prospective speakers to garner a glimpse into their stands and perspectives on public health and to ensure they saw public health as a top priority. Following the election, I've continued that dialogue with Mayor-elect Greenberg and his team. And so we will keep you posted and we will have the mayor elect now, but to a future meeting to share both follow up on his actions or his promises to the board and what he plans in the area of health. Moving on, Dr. Howard, I believe you have a positive news item to share with the board.
Yes, Heidi, thanks for the opportunity to speak to the board today. So a couple different points. Thanks for pointing out we're meeting with the transition team, and I think our team is very excited about doing doing that tomorrow. We did receive a CDC infrastructure grant award in total of $9.4 million. We will receive that over the next 5 years as part of their Strengthening Public Health Infrastructure, Workforce, and Data Systems grant. We will be using a lot of that funding to help support some of the work that we were funded to do during COVID, and now that funding is moving away, but we're very excited to announce that. One item that I did not mention to the board chair in preparation for this meeting, but I want to take 2 sentences to mention is the flu season has picked up over the last 48 to 72 hours, 96 hours in a way that was relatively unexpected. The flu vaccine is very effective based off the most recent study. However, our hospitals are starting to get very, very full. ERs are full. So I would encourage members of the board to use your influence to encourage folks to get the vaccine and for people to realize that healthcare resources are extremely limited. Many patients are being held in ERs right now all across the city for 10 plus hours because of staffing shortages and bed shortages.
Indeed. And so I would encourage in your messages to your networks, there's a reason, there are many reasons for this, not the least of which is for 3 years we all wore masks and our immunity levels are down. So I would encourage you when you're in unfamiliar groups, etc., to wear a mask if there are substantive numbers of people, because it's inevitable. And I can just tell from a mini survey of my friends in terms of how many dinners have been canceled, how many receptions, etc., due to flu. So hang in there. Let's see. Let me flip through announcements or action items, not regular updates. Thank you, Dr. Howard. I forgot to say that. And congratulations, by the way, to the health department team on that grant, which is much needed, and look forward to many more kinds of positive news items. Now these are announcements or action items from community advisory board members. So let's start with, and I haven't looked at the Dr. Stone, any announcement or not an update, but any announcement or action that needs a board vote?
No, nothing that needs a board vote.
Okay. I would assume the schools are likewise with flu. I know some were closed in other counties due to flu, so be careful.
Yeah, we've got about 700 cases around the district, but thanks to that electronic health record that you all granted us our first year, we're able to do some really close surveillance, and we've got some rapid response teams that go out to the school and give vaccines to students and staff, and we started vaccinating. The state has given us some flu vaccine for students, so we started those clinics this week. So
perfect. Thank you. And please thank your team for all they do.
absolutely.
Greater Louisville Medical Society, I didn't see Dr. Val or anyone on. Delano Manson. And I know she had another commitment. And I will be doing a follow-up to you guys with a link from Shelby Somerville from GLI with their state policy agenda and their Louisville agenda, public policy agenda comes out in January. So you'll be getting that. Now to committees, Dr. Irwin, Ms. Shoemaker for Family Health Center announcements or actions needing the board's approval. So
I neither have
Ellen?
any announcements or any thing that needs to be approved by the board.
Okay, thank you. Ms. Shoemaker?
Just to announce that,
We can't hear you?
can you hear me?
No, barely.
Okay, can you hear me now?
A little bit?
Oh, okay, just to announce that, open enrollment, for Connect continues until, January 15th.
Okay, thank you very much. And the next meeting of the committee is?
It is Monday, December 12th at 4 o'clock.
Thank you very much. Dr. Eccles, Dr. Bautista Cervera, immunization, any announcements or items needing board action?
Neither of them. No action, no announcements, no actions to need voting. Thank you.
Dr. Eccles, anything? No, okay. Let's see. Is there any new business to be considered from any board member? Anything I missed? Okay. One item to bring up, and Dean Compton, and but stealing thunder from Dean Blakely, as a point of personal privilege as a U of L alum, as is Karen, I know, and there may be more of you here, was really pleased with the announcement of Dr. Kim Schatzel as our next university president. Strong record in the areas of strategic priority to this board. And also very pleased that Dr. Gonzalez will stay on as provost. I think it's a dynamite team and a commitment, especially in areas that are important to this board. And praise to Dr. Gonzalez, who had many achievements as interim president, took the university through some difficult times. She clearly is a steady, collaborative, and outcomes-based leader who did place a priority on health, and it's her background as well. All right, any other announcements? Anything? All right, hearing none, I shed best wishes to you and your families for a healthful, insightful, and engaging 2023. If I don't hear any objections, happy holidays, and see you next year. Big hug. And I see we're adjourning at 8:14. Thank you so much.
Thank you.
Bye.
Happy holidays.
Thank you.